and then after that we'll mute. So I'll get my flag up. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with justice for all. That's fairly decent unison. Anyway, so now if we could mute, I'm looking at our slate. Do we have?
Dan, you're muted.
Sorry about that. I was just looking around. I do not see any guests, so I will dispense with that. Or am I missing somebody? I don't think we do.
Not that I've seen come in, Stan.
Okay. Announcements, only a few, but an important one. Election Day is next Tuesday, August 4. And early voting is going on both today and tomorrow and on Monday the 3rd, but only until noon. So if you want to do the early votes, you have to be there before noon on Monday. I know we have civic-minded people, so I might be preaching to the choir. Of course, get your census completed. But I would go one step further. If you're in any kind of social gatherings or any kind of gathering for that matter, and could put out the reminder to get other people to their census. We want Shawnee County to be fairly represented, and we need everybody to get the census done on the ballot. With that, I'm going to ask our club member, Zach Aarons, to introduce our speaker today. Take it away, Zach.
All right, thank you. So, for over 30 years, Rotarian Karren Weichert has been a pioneer and a leader in responding to the most challenging healthcare needs in the community. She was Midland Care's first employee. Now we have nearly 400, and she was appointed executive director in 1990. She grew Shawnee County's first hospice provider from a small community organization to one that has served more than 100,000 patients and families across Midland Care's continuum of care, which now has services in 21 counties across northeast Kansas. Under Karren's leadership, Midland has grown to provide hospice home care, hospice inpatient services, home health, palliative care, home support, Meals on Wheels, a program of all-inclusive care for the elderly, or PACE, assisted living, adult daycare, residential care, as well as community-wide grief and counseling services. She's long advocated for those who need care and has spent many hours lobbying at the state and local level to make healthcare more accessible to the most vulnerable members of our community. And her efforts have been recognized by several awards. I won't read all of those now, but definitely a lot of awards, as well as a lot of national and state organizations and committees and appointments, including one from Governor Collier at his time of being governor, to an organization as well. She is a Rotarian, and her and her husband, Ivan, of 46 years, have 3 children, 12 grandchildren, which keeps them very busy and young. So it's my privilege to introduce my friend and boss, Karren Weichert. You're on mute, Miss Karren.
Oh, I'm unmuted now. All right, thank you. Well, thank you, Zach. I appreciate being here with you today, and isn't it nice we can all be inside on this lovely rainy day? You know, as Zach talked about all of the things that we do, just very simply, Midland is an integrated care continuum that really focuses on helping people to stay at home, helping them to age in place, and helping them to die at home, if that's their wish. And so we have built these services really in response to needs through the last 40-some years now that hospice at Midland has been around. I say hospice because that's what most people know us by, is hospice. But in reality, we have a very complex organization these days. So I thought the best way to do it is just to tell you a story. So I'm going to tell you a story about a man who was very special to me because he actually was on the board of the hospice organization when I was hired. And he was a man of great vision, and he was a man of, you know, you can just do anything if you really set your mind to it. And he was also a man of inclusivity. He felt like we needed to respond to where the needs were and try to serve whoever needed help. And that's the continuum that we have built at Midland Care. So this gentleman about 10 years ago actually came to us as a client. He had become physically frail. He had some neurological issues. His wife was having trouble managing him. And as is often the case, it becomes the frail caring for the frail. She also had her own issues. And so she had heard about our adult daycare program. So that's where she started him. Coming to our adult daycare 3 days a week, and then that grew to 5 days a week. And then, sorry, problems with being at home and robocalls. So she was bringing him to the day center, and then she had difficulty getting him there. So she wanted to know if our transportation could help transport him, and we did that. And then she was having trouble because he was a rather large man and she was becoming more frail. So with his personal care, she needed some help in the home. So we sent in some of our staff from Drive at Home, who went in to help bathing and shaving and just those personal care things that he needed assistance with. So they would go in the morning, they would get him up, get him ready to go. Our transportation would pick him up and he would come into the day center. And that continued for a few years. And then he began a decline. And she was having trouble getting him in the car. So that's when she said, how about this PACE program? What is that anyway? So we enrolled him in PACE, which is a program of all-inclusive care for the elderly that wraps services around individuals. You only have to be 55 to qualify, but you have to be nursing home eligible. Someone who, by the nature of their diseases and their complexities and their frailties, would qualify to go into a nursing home. Those are the people we serve in PACE, and he certainly qualified. So he enrolled in our PACE program. So now we are still sending someone in the morning to help get him up, but now it's from our PACE program. We are still transporting him to the day center, but now it's part of the PACE program. And while he's at the day center, he now gets to see his primary care physician, who is part of this program. He gets his physical therapy and his speech therapy. He also gets transported to any of his specialists that he needs, his neurologist, and he gets fed a nice meal and has a time to socialize with other folks. And then we take him home in the evening. And then we also would send somebody in the evening to assist with getting him to bed because, again, she had difficulty doing that. So that continued for a couple of years, and then the wife actually had a health issue and had to go to the hospital. So when she did that, she didn't know what she was going to do with him. So she had him admitted to our residential center, which, if you don't know, that is the lower level of our hospice house. So that's not hospice down there. It's a residential center. And so he moved in there just for a short time, we thought. But she began to have quite a few issues, and she couldn't take him home after she got out of the hospital for quite some time. She had to have some rehab herself. Again, it's a typical story. We hear this all the time as couples are aging. He also was starting a significant decline. And so we got a palliative care consult from one of our physicians in to see if we could help with some of the pain issues that he was having. And it was determined that he really was ready to go on to hospice. And so she enrolled him in hospice. He never did get to go back home after that admission for a respite stay into the residential care because of his decline and his wife's decline. But he was on hospice at the end, and he died on hospice on Christmas Eve, actually. And by his bedside was his wife, who had come every day to see him that last year of his life, and members of his hospice team, members of his PACE team, and members of the residential care center. That was his family that embraced him and said goodbye to him that Christmas Eve. Following that, we provided bereavement care to his wife. And then she wanted to become a volunteer, and she actually enrolled in that, but unfortunately her health didn't allow her to do that. But I love that story because he used every element of what we do at Midland Care. He started out with our adult daycare, which we started back in 1992. And that serves folks of ages over the age of 18 who cannot stay at home by themselves because of their physical frailties. And so they can come to our day center, which operates Monday through Friday. Now, here's an interesting thing about adult daycare that many don't know. Adult daycare is any part of the day. So in reality, because we have the facility, we can actually provide adult daycare to people in the evening, or from, if somebody's working at Goodyear 11 to 7 and they need to bring mom to stay with us, that can happen. So we can do that at night as well. So it's a really a fascinating program that's terribly underutilized in our country. I do think that COVID might change that, and that people might begin to look at other options that can help them keep loved ones at home, but also give them some of the break and the support that they might need. And adult daycare could be a great answer for that. So he started in adult daycare. He went to our Thrive at Home program, which is a home support program consisting of nurse aides and nursing to go in and really give some of the physical supports that might be needed, run errands, do some light housekeeping, and those kinds of things. Home health was a program that I'm not sure he ever used, but that really is if there is a skilled need. It usually follows a hospital stay, so where maybe they've had some surgery and now they have a wound, or they've had a hip replaced and they need some physical therapy. So it's got something to do with some sort of a skilled need, and that's our Medicare home health. He also utilized our palliative care consult service. That's primarily a physician consult service. We've worked with both hospitals here in town. We provide a community palliative care program, so people don't have to be in the hospital. They can just come to our clinic there that's on our Fraser campus. And then, of course, he used Meals on Wheels throughout this whole thing. And many of you may know that we partnered with Meals on Wheels a few years back, and now they are just a program of Midland Care. And we're growing that program, as you can imagine. Again, in this time of COVID, there are a lot of people who are at home, cannot get out to go grocery shopping, and don't have the resources to do it even if they could. And so we are finding that that's growing. And I do want to stop and say something here, because a couple of weeks ago I was on the Rotary meeting, and I heard the comment that somebody had attempted to become a Meals on Wheels volunteer, and we had not responded very well. So I want to apologize for that and say, it's a confusing time. And I'm not sure why that ball got dropped, but we really do need volunteers at Meals on Wheels. And it is certainly not our intent to make it difficult, but we also do need to be sure and screen and make sure that people going into the homes of these frail seniors are who they say they are, and that they are safe to be delivering meals to our clients. And so I do apologize for that, and I hope whoever that was might reach out again and attempt to do that, because we do need volunteers. As you can imagine, a lot of our volunteers have backed off right now because of COVID, and they're nervous to be out and about. We have been fortunate or unfortunate, I'm not sure which, but we've not been able to have our PACE centers open during COVID. So we've had a lot of staff that we've been trying to keep employed that have been available to deliver many of those meals for us too. But as things change, and we hope that they do soon, and we start to open those centers up again, our need for volunteers is going to grow exponentially. So hope that you might reach out again and consider volunteering for Meals on Wheels. So our program is pretty deep. And, as we went through all of that, his life ended with hospice, which I'm guessing that for many of you out there, that's where your story with Midland begins, is with hospice. And I think it's important to know that we have a full continuum of services. This gentleman actually was on service with us for 7 years. We just had someone celebrate a 10-year anniversary in our PACE program with us. Last year, we lost someone who had been in our programs for 15 years, had originally started out in our adult daycare and had then gone to PACE, and actually died at the age of 95 at her home with the supports that we were able to provide to her for over 15 years. So we have a lot of success stories. But I will tell you that everyone is a privilege for us. We really do consider this work a privilege. And that's one of the first things that I say to new staff coming on, that I believe that where life is beginning and life is ending is holy ground, and we have to treat it as such. So that's the type of program that we've tried to develop to deliver care to the people that you love, and the people that others out there love and embrace. We want to be there to support them, because one person has the disease, but the whole family is going through this process. So it becomes really important that our program is inclusive of all the members of the family and trying to support them. So I'm going to pause there and see if there are any questions out there for me.
Karren, this is Larry. I don't have a question, but a comment. And it was 3 years ago that my mother-in-law was admitted to Midland Hospice, and she only was a resident there for 24 hours, but we're still in touch by people who are sending cards and letters and asking for outreach, and if we need anything. And the people were tremendous during those 24 hours. I have never been through it, and if you have, I would certainly bring my family, my folks to Midland. It was outstanding.
Thank you. Thank you.
Hey, Karren.
Yes.
Your fellow Karren here. Do you guys ever offer any kind of lunch and learns where seniors, my parents are in their mid to late 80s, and we're starting to look at different options for all kinds of things. So do you ever offer any educational opportunity for people to learn more specifically how they can benefit?
That is a great suggestion. Zach, did you take a note? Because I think that's something that we could do right now. We could advertise and do that, via a Zoom call or something, the smaller groups there within our center. So we have done that in the past, but it hasn't been for quite some time. One of the challenges that we've had is growth, which is good, but also comes with challenges. So we used to provide community events a lot out at our center on Fraser, but parking got to be an issue. So we had to pull back from that as we were growing. We actually that's a great segue though into a new thing that we're doing, and that's trying to shore up our campus a little bit. We're going to add some more parking to it. We're going to be doing some work on our hospice house, which has not been renovated in over 20 years. We opened it 20 years ago this year, and it has served thousands of people and served them well, but it's starting to look a little shabby. So COVID has also brought to light that there are a lot of new things that we need to do in terms of infection control to really build this into a building that's going to serve people in the future better than it can today. And so that's part of a goal that we have. We had been doing a capital campaign for that. We raised most of the money. The first part of that campaign was for the Westport Center, our PACE Center, which you can go by and see. It's lovely. And so we finished that last year. And then the next phase of that is to finish up our hospice house, where we're going to add what we're calling a keeping room, but a way to transport patients out of the facility after they've died in a very graceful and dignified way, and give family opportunity for last moments with them there. So we're making those modifications, as well as some infection control changes that are going to be coming around, and some increased parking, so that we can do exactly what was just requested, as those kind of seminars for the community again. But in the meantime, we certainly could pull together and do a seminar like this, and I think that's a great idea, because I think people are looking for what can we do with our loved ones. They're nervous about nursing homes. We know that COVID has hit nursing homes very hard. It's not anything bad about nursing homes. It's just that it's a close proximity. It's a close space, a lot of care, a lot of close care. And so people are looking for other alternatives now to delay nursing home if they can. And certainly many of the programs that we have at Midland could fit that bill, but people don't know about them. So I think a webinar is a great suggestion. Thank you for that.
It's Grace here. I've had a couple of personal experiences with hospice with my father-in-law and my sister. And in both cases, these available services were taken advantage of very, very late in the game. And it's quite an amazing program that exists. And what efforts, if you know, are being made to make people aware of hospice? I mean, it's just underutilized just because there's so much good that comes out of that.
Thank you, Grace. That is a great question, because we do get referrals very late. 70% of our referrals die in the first 30 days of care. So it's very short time that they have with us, and it's unfortunate because it's such a comprehensive program that can support not only the patient but the family, and really help them all through a very difficult time. with not only the medical care, but the emotional support that we can bring, the chaplaincy we can bring, the equipment that we can bring into the home to support them and make their lives easier. So it is something that we've been dealing with now for about 40 years, trying to get the word out there that this really is a program that can start much further up in the trajectory of one's care. And so it's just delayed because people are afraid of that word hospice, and they are afraid that it means the end of their life. My father was a hospice patient over 35 years ago, and he was on service for 18 months. That's okay. He was still dying. He was still progressively getting worse, but he just didn't die in 6 months like people thought that he might. And that's okay. And we do see that occasionally, but it is very, very rare. We usually see 72 hours to a week, maybe, is what generally. So we are trying to get that word out to people. Again, I do think that this is a new day, and it's a new opportunity to introduce what hospice can provide to people. And so we're working on how we're going to message that so that people can access the care that they need earlier. And one of our biggest obstacles, quite frankly, is sometimes doctors. Because it's difficult to have those conversations with people. And there's so much out there that we can get from the internet, and there's this treatment and that treatment, and why can't we try this? And we all try to do it. But sometimes just having the reality check and the conversations about, is this really what you want to do? Do you know that this is going to, really compromise your quality of life if you undergo this treatment one more time? So there are those challenges and those difficult conversations that I think doctors are getting better at that, but still families aren't always open to hear those conversations either. So while there's a lull and you're thinking about other questions you might have, I do want to say this because I would be remiss if I didn't. We're a not-for-profit organization. And although we are very blessed at this time that's so difficult for so many, our primary revenue is Medicare and Medicaid, and that's continuing for us. And so we're still able to provide most of the care that we need to. However, we also are the only not-for-profit hospice in town, and so by our reputation and history, we have taken all of those patients who don't have any resources. And so the challenge for us now is, like in many of the nonprofits, we have had to postpone our event to raise dollars, which was our celebration walk. So it's going to a virtual event, but usually it raises about $125,000 to $160,000 for us, which we need because we give away every year about $500,000 to $600,000 in free care. So right now we're scrambling, Zach's scrambling, I'm scrambling to try to figure out how are we going to make that up. So we are going to do a virtual celebration walk later on in September. The other thing that has been impacted is Meals on Wheels and our sumptuous evening that many of you have participated in. Well, there's no way we can hold an event like Sumptuous Evening with all those buffet lines and all those people. So that's been delayed until sometime next year. So again, that raises about $160,000, something that we've got to figure out how to make up. So we're working on that. We've been lucky to get some grants and so on. But we do depend on the community. And I want to thank each of you. There are many people out there on this call who are donors to us and have been for a number of years. So we appreciate that commitment to our mission. Any other questions? So I want to say something about our bereavement services just as kind of a final wrap up, because that's kind of at the tail end. It was at the tail end of my story, but it really is an important component of what Midland Care does now and has been doing for over 3 to 4 decades. And that is providing that supportive care to people who are grieving. And we have a pandemic in our country right now with COVID, but we also have a pandemic of grief because so many people are losing people that they love. And sometimes quite suddenly, they're becoming ill very quickly and going downhill and dying in a matter of days. And so there is a lot of grief out there right now. And Midland has always been an organization that fills in those gaps and serves people regardless of whether they have been in our programs previously. So our grief counseling services actually are open to the community at large. We've been doing a lot of Zoom meetings, Zoom support meetings through this COVID experience. We're getting pretty good at it, but it's still not the same as sitting in a room with one another and sharing stories and sharing tears and remembering. But it is an important part, and it's an important part to our community. We also have a pretty extensive children's grief program. So we work with the schools when they are in session, and we do support groups in the schools. We work very closely with 501 and have offered many groups in all the different schools throughout 501. But we've worked with most of the schools around our area, especially when there's been a sudden death of a student or a teacher where they needed some additional support in there. So I wanted to make you aware of that because that's another thing that's supported almost entirely through donations that we do at Midland Care. But it's something that we do quietly and it's not often heard about, but it is a resource available to you or people that you might know who might need some grief support. Anything else? Zach, what have I forgotten?
I think you covered it very well. I think the other reminder is just that we continue to be open and continue to serve, and we are 24/7 and have continued to be during COVID. So if there's a question or something that someone has, I know Karren Streeter, you asked a good question, give us a call and we can sure help, especially during this time. You don't have to have the answers to call. That's what we're here for.
Yeah.
Karren, I greatly appreciate it, and Zach, I appreciate it also. I'm glad I had my computer on mute because my phone started screaming at me. I thought it was an Amber Alert, but it was a flood alert, and maybe it happened to you too, but it was loud. Probably everybody got it. In any event, I appreciate the presentation. Midland Care is truly an asset community, and actually beyond our community, Northeast Kansas. Next week's program is Steve Anderson, who is the CEO, and I still like to call it St. Francis, but its official name is University of Kansas Health System, St. Francis Campus. That's a mouthful, but he'll give us an update on what's going on at St. Francis. So with that, I don't know if anything else, and I would just invite you to unmute and then join me for the 4 or 4.5 way test, as you may like to call it. Of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? And will it be fun?
And is it kind?
And is it kind? There's our 6-way test.
Yeah.
Thank you, everybody, for joining. I look forward to seeing you next Thursday. Take care and stay dry.
Okay.
Thank you. Thank you.